Hi everyone, today we're going to be talking about some of the top challenges that patients and family members face as they go through a healthcare system. Now, the idea of this video is not to individualize or isolate a specific type of patient behavior, nor is it to isolate one specific part of the healthcare ecosystem. But really what we need to understand collectively is that these are not local-based challenges. Rather, these are systemic global challenges that the entire industry is actually facing. So for patients who are watching this, I want you to know that your feelings are valid, that we acknowledge them, and that there are other people in the system, including those of us who work in the system, who feel the way that you do. And for my colleagues and friends in the healthcare industry, whether you're on a management team or a policymaker or a doctor or an insurer, this video is really for you to reflect on these challenges, to be reminded of them, and to think about these challenges from a patient's perspective. So when we make these changes, and while we're working very hard to make these changes, we keep our end user, who is the patient, in mind. So let's just jump right into it. This list is in no particular order, but we're going to start off with dismissal of concerns. So I'm sure we've all walked into a doctor's office where it seems like they're just not listening. So they're telling us to talk to them, and we're giving them our symptoms, telling them how we feel, and they're either pish-poshing our concerns, or it just seems like they don't care. So there's a perception of dismissal that comes with this. And this is the last thing we want to feel as patients when we are with our trusted doctor. This is not only an emotional issue, it leads to clinical consequences like delayed diagnosis, prolonged illness, and a mistrust in the provider and in the physician who works for that particular provider. From a system perspective, you're looking at decreased patient engagement, which is not a good thing. We always want our patients to feel safe and protected within any kind of hospital or clinic premises, and we don't want them to lose trust in the system as a whole. We're also, in a sense, increasing inefficiencies because that same patient would need to go to multiple providers, or at least another provider, to try and figure out what's wrong with them, and hopefully they get an answer at that stage rather than then going to a third person. The second challenge is financial burden and high costs. For patients who don't have insurance, they end up having to pay substantial out-of-pocket expenses for any kind of healthcare that they avail. For patients who do have insurance, they have to deal with the complications of the insurance structure, which essentially means unclear coverage, dealing with approvals, denials, and so forth. And most importantly, for the purposes of this particular challenge, the rise of insurance premium costs over time. And rather than deal with all of these things, some patients would rather forego medical assistance. And this creates multi-level implications. For example, increasing the ER admissions because they didn't take care of something that should have been taken care of way back when. The other one is poorer long-term outcomes for the same reason. And the last one actually has to do with financial burdens falling on healthcare providers and insurance providers. So addressing this issue isn't just ethical, but it is financially and operationally prudent for the provider side. Challenge number 3 is navigating complex care transition. Now, what does that mean? When a patient is discharged from the hospital, what is being done to provide them with as much ammunition to continue their care at home? Hence the phrase continuum of care. A lot of the times when a patient leaves the hospital, they go through an incomplete discharge process. There's poor to no communication on what they need to be doing, on their follow-ups, and it's a very fragmented kind of discharge, which doesn't help the patient recover at home. So this often leads to patients feeling confused. It leads to medication errors and preventable admissions or readmissions, which increase the insurer and provider costs, but most importantly, it ends up harming patients. The last topic that I'll touch upon is medical misinformation and health literacy. If patients are not educated or communicated with in the right way when it comes to understanding their own medical information, they're going to go and try and look for other alternatives and other solutions and other translations which help them understand what is going on with them. This is a human thing to do. Gaps in literacy increase patient anxiety, increase non-compliance of treatment protocols. And what we're trying to do is make sure that our patients don't go online and find information that's actually going to mislead them and misguide them. Because a lot of the information that you do find online, especially through social media and sort of these viral pages, is information that isn't evidence-based. And so what we want to do is see how we can spend more time with our patients, educate them in the correct way so that we decrease their risk, decrease the harm that may come to them, and again, decrease our costs and increase trust that patients have in their providers. Thank you to all of our viewers for taking the time to reflect on these realities. And I do know that these are not all the challenges that we face on a regular basis. There are other more important topics such as cybersecurity and data privacy, which we will cover down the line in a little bit more of a robust form. But I think recognizing the weight of these issues in general, recognizing that we're all part of a bigger system, is the first step towards meaningful improvement. And I think, or rather I hope, that while we make these changes, we're able to do it in a more collaborative manner, which really is in the best interest for all of us who play a part of this healthcare ecosystem. I'll see you again next week. Thanks for joining us.